Good evening. My name is Oge Okeke, and this is One Health, One Medicine, a global approach to the final experience by Dr. Satish Badesi. Today I'm going to be discussing a health burden and a disease known as aspergillosis, and I'll be talking about it from the viewpoint of a health professional and giving advice, a health professional giving advice to a community. So let's get right into it. Aspergillosis is a group of diseases which actually result from a fungus known as aspergillus. Aspergillus, the fungus, is one whose spores are normally present in the air that we breathe normally on a day-to-day basis and doesn't necessarily cause an illness. But when it does, it can be fatal. Aspergillosis not solely affect human beings, and as we've learned in One Health, One Medicine, um, you know, diseases can be carried across from one human being to an animal and sometimes to a plant, and that's actually the case with aspergillosis infection. So going right into it, the different types of aspergillosis, and each type has different symptoms. We have the allergic bronchopulmonary aspergillosis, and here this causes inflammation in your lungs and allergy symptoms such as coughing and wheezing in sinuses. Sometimes um, you also have inflamed lung when it comes to that. Allergic aspergillosis sinusitis is another type. Then you have aspergilloma. Aspergilloma is pretty much a fungus ball whereby the fungus forms a ball and blocks the movement of air in your lungs and also can cause serious symptoms such as coughing up blood, chest pains, and difficulty breathing. Other types of aspergillosis include chronic pulmonary aspergillosis, invasive aspergillosis, and cutaneous aspergillosis, whereby the fungus can get into your body system through your skin. And if you have burn wounds or you have a cut open wound, so this has something you have to be careful about. Now, talking about ways of transmissions and signs and symptoms of aspergillosis, there are different types of aspergillosis, like we said earlier, and each of them have their own different symptoms. For instance, allergic aspergillus sinusitis is one whereby you have symptoms such as stuffy nose, runny nose, headaches, reduced ability to breathe. When you talk about aspergilloma, which is the fungus ball, you have coughing up of blood, shortness of breath. And chronic pulmonary aspergillosis, which is actually one of the most serious types, is one where you have extreme weight loss, coughing up of blood again, fatigue, shortness of breath. It's usually important to call for emergency health healthcare checkup immediately because people can lose so much blood and actually die as a result. You also have invasive aspergillosis, and this causes serious fevers and causes coughing up of blood as well, shortness of breath. So these are the spectrum of the higher, very, very, very bad cases of aspergillosis. Now, going to the testing and diagnosis, as you can see, healthcare providers, one of the biggest things they have to do is consider the medical history of the patient. They also have to endeavor to do chest x-rays, CT scans, and also to collect samples of fluid from the person's respiratory system might be helpful. That can be sent to the laboratory. Healthcare providers may also perform tissue biopsies, and this can be checked out and blood is tested in the laboratory, and then you can know what type of aspergillosis you have and at what stage it is at. People who are at a higher risk group of having this disease include people who already have predisposition to lung diseases or have lung disease such as cystic fibrosis or asthma, tuberculosis, or people with a weak immune system like people who have AIDS or cancer patients. Ways in which we can prevent this disease include protecting yourself from environmental agents such as dust and soil. A lot of times these do not help for you to respirate when they collect in your lungs in a large amount. So you should avoid activities that involve close contact with soil or dust, especially when it comes to children. Make sure that they're clothed with long pants, long sleeve shirts. If you're going to do activities such as yard work, gardening, or visiting wooded areas, because this is where these agents will be in high amounts. You can also additionally use antifungal medication or testing for early infection is very important because and this is one of the case management. It's important that especially people who have a weak immune system, they should be tested for early. Their blood should be tested to make sure you can detect whether they have aspergillosis early on or not. Long-term oral itraconazole could be successful in up to 60 patients. So these are important things that you can take, and so hopefully you guys learned a thing or two from this presentation. It was a pleasure. Thank you very much. Good night.